The 15 years concession agreement between the Federal Capital Territory Administration and the NISA Medical Group over the management of Garki General Hospital has elapsed, as the Federal Capital Territory Administration announces the taking over of the management of the hospital. On Friday, the medical director of NISA Garki Hospital told journalists in Abuja that all equipment, current staff strength amounting to 900 were brought in by NISA Hospital, will be moved out as the agreement terminates.
I said the concession has a time. I know pointed out that it was concession for 15 years, and that 15 years has come to an end. Where we go to from here is up to the government, right? They are the ones that will decide how we are going to proceed. But like you rightly pointed out, every single staff you see working here was employed for this PPP by NISA Premier. There is no government staff with us. And in the same vein, every single equipment that we use here to provide service was also brought in by NISA Premier Hospital. So if you go to our ICU, you look at the equipment there, look at our dialysis machines, CT scan, MRI, lab equipment, every single one. So again, like I said, during these 15 years, this concession has saved the government a whole lot of money. Wow. Without calling for a precise report, I can't estimate, but we're basically talking about billions of naira. At least I know that over the last 15 years, we've spent over 10 billion in staff salaries alone, not to talk of how much we've spent in terms of training, not to talk of how much we've spent in investing in equipment, whereby people are able to come in, have their tests done, have results, and have treatment. So we've saved government a whole lot of money. Currently, we have approximately around 900, thereabout, give or take a few numbers. There are clauses in the agreement which call for review, opportunities to review the agreement. We had written to them several times, at least 4 times, taking advantage of that clause to seek meetings, to discuss lessons learned, how to strengthen and review the agreement, and to bring it in line with international best practice and ICRC regulations. Bear in mind, this was the very first ever PPP concession of its type in this country. And it's supposed to be aligned with the ICRC Act, which governs all such concessions. So yes, in the past we had written to them several times, but we received no reply from them. So that's really what has happened. But beyond that, I mean, like I already said, where we go from here, it's up to the government. It's the concession. I mean, the truth is, like, the 15 years have ended, right? And it's perfectly within the rights of government to decide what they want to do, right? It's perfectly within their right. But at the same time, I'm pretty sure they'll be guided by what is in the public interest.
Patients at the hospital speaks on the services they enjoy during the public-private partnership.
That would really be bad, because so far I've been using the hospital for over a year or 2 now, and they have been giving me top-notch services. And for me to come here today and then discover that it's no longer functional, it would have been really bad, and it would have affected me a lot. I brought my nephew here for treatments, and if I could not have the services I needed today, it would have been really bad. So I hope that the news is also for the best, that maybe the new people that will be in charge of the hospital will provide as good services as the former.